We are working very hard. We have another call in a few minutes on this issue. Our hospitalization numbers are up. Our infection rates are starting to go down. Our hospital bed capacity is still, it's pretty strong, but there are a couple issues here. When we see the increases, two things are happening. First of all, we have nursing home patients who have been, affected with the virus, who have gone to the hospitals. They no longer need hospitalization, but they can't go back to their nursing home. They're still in the hospital. That's one of the bed capacity issues. The second issue is anyone going in for outpatient surgery, elective surgery is tested, and the hospitals are finding asymptomatic people coming in for something other than coronavirus having it. So while they're not in the hospital for that per se, they might not have any symptoms. They're testing positive. It still goes in terms of numbers. So those two things are happening. Our trends actually, we're holding very, very steady and firm. I think the region's doing a very good job. The issue that we're worried about, the infection rates are going down. This Friday marks 2 weeks since phase one reopening. Usually it's 2 to 3 weeks before you start getting infection rates coming in from an open. We can't say right now, are we going to see an impact from the manufacturing, construction, and some of the light retail opening? We hope not. The infection rates so far and the issues have been pretty much localized to nursing homes and our hospital systems. But right now, I do feel the region is really hanging in there, doing well. I think all the areas are still within the metrics the governor is looking for. But again, the governor defines when phase two starts, what is in phase two. He's made some comments already. We can't say, there's no certainty whether it will start Friday or not. We don't know. We'll probably find out the next day or so. We're looking forward to that. But he has made no statements about that yet. And I've learned one thing: don't get in front of the governor. Just let him make his decision, and which probably has some reactions as of late. It's great to say things, but the governor, we have an executive order that really governs the state for these issues right now. You can't be violative of that. You can't get out in front. But our job and the chamber's job really with this whole effort and our regional control team is to get information to the governor's team every day. We've done it consistently. So we are constantly getting information from businesses. We want businesses to be open. We want them. We've advised them on plans. We've directed them to websites. We are working alongside them. But the decision is not anyone's locally. It's not mine. It's not Vinny Esposito's. It's known here. The decision rests solely with the governor, and he's going through those metrics and the data really as we speak. And we should hear at some point in the next few days where his decisions are going to be.
We have some questions lined up. We'll start with Wendy Wright.
Hi there. Good to see you. Sorry. I wanted to ask you, basically coming right off of that, your reaction to Greecetown Supervisor Bill Rylick and his decision to allow permits for restaurants to begin outdoor seating and service. He is already issuing those permits, allowing this to happen, and some are expected to open as early as Friday.
Well, first thing, I'll be clear on one issue. We have forwarded countless plans from restaurants for outdoor seating, suggestions from restaurants. Clearly, restaurants want to expand their capacity and do it safely with social distancing. So we have forwarded to the governor's team some very thoughtful, comprehensive, great plans on behalf of restaurants. We get the pain they're going through. So the governor's team has that. The Greecetown supervisor can do whatever he wants. The only thing is the Greecetown supervisor can't override a governor's executive order. So he can say what he wants, and I certainly, he's a town supervisor, but my comments yesterday were, I would not get out in front of the governor. We don't know where he's going to stand on this issue. We don't know. I have had no indication. Our job is to get that information to him. But to issue permits and to open up and go in that direction, that if it's in any violation of the executive order, I think you put people at risk unnecessarily as opposed to just waiting. And we have a 9-county group working on this, a bipartisan group, all the way around, elected officials, the mayor, the county executive, leaders around all other 8 counties. We discussed these issues. The city has talked about laying some groundwork for plans for outdoor seating in restaurants and others. But it's interesting, no one has announced their intention to go forward yet. on their own, except for one person. So, hey, I am not an enforcement mechanism. I am an advisor. All I can do is give the best advice, and that is I would not get out in front of the governor's decision, nor would I be in violation of that executive order. And perhaps Friday may come with some good news, perhaps not. But what if it doesn't come Friday? What if we don't hear anymore? And again, I'll leave it up to the supervisor to make his decisions, but it's just interesting. No other elected official in a 9-county region has made any similar statements. So statements are easy to make, but I just would not do something that would put your businesses, which have already probably suffered way too much during this ordeal, at any additional risk. And the issue, Wendy, we've talked about too, outdoor seating would be a great asset. But if there is alcohol being served there, there's state liquor authority guidelines, there's rules of that. It's a state decision. And a town ordinance that only works for the town is fine, but when you announce you're going to do something that could be in violation of a state executive order and a state rules, I just would say I would hold off, because we would love to see guidelines change to support that. But to get out front is really, it's not a good way to do it. You can make statements, but believe me, working behind the scenes with all of your elected officials, which we're doing right now in the same thing, we're listening to them, we're taking their input, we're passing along. I've known Bill Rylick for years and years. He could have picked up the phone and called, and I would have said the same thing. We would help any way that we can, getting those plans forward, supporting his restaurants to get that forward. What we can't help with is going against executive order until the governor makes that decision, and we don't know that yet. We may hear soon, we don't know, but I'm not going to get into a back and forth. Bill can do his own thing, but we are trying to do what's right by our businesses, trying to do what's right in terms of getting information out. And the plans that I and we have forwarded to the governor's team have been phenomenal, from restaurants, from associations, individual restaurants. We understand the pain they're going through. We do. We want them to be reopened safely. But keep one thing in mind, there's a whole different side of this that we deal with as well. And it's the people that are writing us, calling us, emailing us, who are afraid to go back to businesses that are reopening. So we have to manage the fear. We have to manage that process. And every business that is going to reopen has to self-certify on the state website in terms of what they agreed to do. That's really the first step. And, if the governor, if he has his executive order, if he updates that, changes it, and allows it either now in phase 2 or phase 3, then perfectly appropriate for town supervisors to issue permits and approve them. That's how it works. But I've had this discussion with City Hall and the deputy mayor yesterday, who's worked hard on this as well. They're just waiting for the governor's approval before they proceed any further.
Go to Berkeley Breen for our next question.
All right, thank you, Dan, and thank you, Bob. Pardon me. Bob, don't the business owners who are in phase 2, don't they have a right to know now whether or not they can reopen Friday night or Saturday?
Well, Berkeley, that's not our call here. We're waiting for the phase 2 announcement. The governor's announced barbershops and salons. We're not sure who else will be there. Going back several weeks, we have advised every business. I've done it publicly. I've done it in the media, on countless Zoom meetings, go-to meetings, email responses. We have advised every business, don't wait for the announcement. Prepare your plans now. And here's the things you should put in those. We advise them what to put in. Now on the website, forward.newyork.gov, you have all the guidelines as you reopen. But these timelines, quite frankly, Berkeley, are the governor's. And here's the issue. The governor's not sitting around waiting, having people wait to the last minute. I will guarantee you, I know he's in DC today with the president, I'll guarantee you, getting back today and tonight, they're going through the metrics. They're going through our hospitalization rates, our infection rates. They're trying to see where are we, because they change daily. And what if the governor announced today we're going to reopen on Friday? And what if tomorrow our infection rates skyrocketed and he pulled back? He doesn't want to do that. So it really is dependent on the health metrics. We are on hospital calls every single day. And I think people out there, it's easy for people to make statements and complain about things, but there's so much work going on behind the scenes. every single day. We want to be reopened. We want to get business back up and going. It has to be done safely. And that's why the hospital systems, the nursing homes, everybody, our county executive, our county health director, they're every single day they're spending time on these infection rates, bed availability, ICU availability. Those are things that we worry about. And for those that complain about wearing a mask in public, those that feel their rights are being violated, I'll go on record as saying, I hate wearing a mask, but I wear one. I have it right in my pocket. I wear one. I have it. We have it all. I get out of my car, I have a mask. I go inside the place, I have a mask. I come to the office, I'm wearing a mask. I stay away from people. Do I like it? No. But I do it. And those are the things, the masks, the social distancing, the hand sanitizing, the, again, disinfecting. That is why our numbers are dropping, and they continue to drop. We want that to happen. And part of what the governor's looking at is what are the metrics with phase one? Do we see any spikes? So far, I will say, we have not seen that. The spikes we have seen have been localized to nursing homes and elective surgery patients. It has not been coming out of manufacturing or construction or retail. That is a great sign right now for us. But then again, I'm not an infectious disease expert, but it does take at least 2 weeks or so before you start seeing that. And we may see the results in a week or so from what happened with beginning of phase one. So the best I can answer your question, Berkeley, is he is waiting for those numbers before he makes the announcement. And I'll tell you what, it's a day-to-day issue with us here in Finger Lakes.
If you have a question, go ahead and use the chat function to let me know. I'll call in the order received. Next up, we have Andrew from Channel 13.
Hey, Bob. Thanks for talking today. Wanted to ask a bit again about the restaurants in Greece and the mixed message. Some of them might take this as, okay, we're ready to open and we're going to open Friday and people might come out and they might start serving them. Do you see this as a slippery slope? Do you see that enforcement needs to be in place on Friday, or that people will show up and start dining out without that state approval?
Well, we've said all along, we want restaurants, businesses, we really want people to get back to normal. We want to see them reopen. Nobody here is trying to stop that, but we're providing information to the governor. He is responsible for the entire state. He has to make these decisions. So those decisions are based on the metrics, which I just mentioned. It is all about that. And I know the issue of outdoor seating, as I mentioned, it's a great suggestion. We have forwarded plans that outline that. There are state liquor authority guidelines for that. But as I said, there's only one town has come out with a public pronouncement. And I would just defer to anything that occurs there. I would just refer back to this town supervisor's office on that one. There's no mixed message coming from the governor. There's no mixed message coming from the region team here. If there's a mixed message, it's coming from one source. So I think he could be responsible for that. We do hope it opens. We don't know. But I just have learned in my life, don't predict, don't get out in front. Don't state you're going to do something if it might be violative of a law or a executive order. Just wait for it to happen. And I do hope it happens soon. I really do. But we don't know. And so there are no mixed messages coming from anyone on our team or the governor's office at all. Those questions I would defer to the Supervisor Rylick on that.
Next question, we have Rebecca Fath.
Hi, Bob. Thank you for taking our questions today. We really appreciate it. So I hate to harp on it, but you said the governor has a team of people who are taking these plans that restaurants have submitted to you, and you've passed them along, right? So I guess my question is simply, can you gauge what are the chances that outdoor seating will be allowed? The governor will lift it by Friday and it will be a part of phase two?
Rebecca, I could not even guess on it. I don't know. We have taken these great suggestions and plans and forwarded them. It all comes back to they're making educated guesses. What will keep infection rates low? What could drive them up? I do think it's a great idea to create more social distancing, to have additional seating space. I mean, no one argues that at all. What phase will that be in? The governor has not said that. The only thing the governor's announced so far for phase two has been barbershops and hair salons. And we get questions every day, what about tanning salons, waxing, nails? He has not stated that yet. We have forwarded questions. We have forwarded plans. We're waiting to hear. I don't have any inside information on what's going to be announced. And my sense is, going back to the other question, I do believe the governor waits to the last minute to make sure that he's going to go ahead with phase 2 for whatever businesses he outlines, that we're safe to do that in whatever regions he picks. And it really comes down to all those public health metrics. As I said earlier, our hospitalization rates, we're still within the confines of being green, but we've gone up to almost a record high recently. We can explain that. We can. But those numbers do matter. So that's why there is a delay, that he really can't give a 2-week notice before he makes an announcement. And so we are waiting. And, listen, I think one thing I would say, we're in a political election season. There's no doubt about it. I mean, you can just tell from some of the messaging and things going on. It takes on all these different connotations, but it's not about politics. It really isn't. It's about public health. And when you look at the number of people, the overwhelming majority of people in this region and really across the state favor wearing a mask. As I said before, do I like wearing a mask? No, I don't like wearing a mask. Is it uncomfortable? Yeah, putting one on, but I do it. It's necessary. Does a seatbelt restrict me? Yes. Do I wear a seatbelt? Yes. Why? Because it's a safety issue. These are things that we just do and don't complain about. And I'll tell you what, I'll speak for our chamber, our region here, and the governor. We all want businesses to get back. Everybody is losing the longer we are staying closed. There's no doubt. But you don't want to start off and reopen and then pull back. That is one of the worst things. You don't want to do that. It is, to me, not only problematic, it can have all kinds of outcomes we don't want to see. So to do it and do it safely. And for all of us, I've not had a haircut in 3 months. Sure, I want a barbershop to open. I've not been to a gym in almost 3 months. Want to see fitness centers open again. We all want those services. But the other side of the coin is, once these businesses open, will customers come back in the same numbers? And I'm just telling you, I get all sides here. The fear factor and the trepidation of going back to normal, walking back on a plane, into a restaurant, a concert, a business, there's a fear factor there. We have to build that confidence back step by step. You do that with great plans, great reopening plans, thoughtful practices to protect employees and customers. That's how you do it. And reinforcement. And reinforcing, we all want to have people shop local, shop small businesses. These businesses that have been closed for so long, we want people to go to them consistently. Don't just go to the big box or those that have really benefited. Go to those that have been shut down and try and give them as much business as you possibly can when they reopen. But that decision rests with one person and one person only. And, he is responsible for that. It's tough being a leader because whatever you do, you make people mad. But the information we've given him, I'm very, very proud of. We pass it along to him consistently every day. He has a great team around him. And I would say this, when people look at how this is being done, I get all the comments, pro and con. I get it. People's tensions are high. They're tired of this. The anger is going. They feel that they've been really shut in. We get that. We understand that. Give people great sway because, there's a whole issue of mental health, of emotional issues coming up with this. We get it. You see it manifest itself in many different ways. But we want this place to be open. We just don't want to infect more people or be back to square one in a month or two.
Got a little over 10 minutes left. We'll do another follow-up after that. We have some more questions on deck. We're going to go to Patty Singer for the next question.
Hey, Bob. It seems to me that the issue of infection rates going up is more than just construction and manufacturing and curbside retail. People are out. We've had a holiday weekend. We've got another nice weekend coming up. Testing numbers have been down the last few days for the county. It would seem to me that, just as you just said, you don't want to close again. Why are we holding to a 2-week schedule when the incubation period is 14 days? Why aren't we going out to 4 weeks so we get a full 2-week look back and then open, as you said, more safely and give people more confidence that we are safely opening up with a longer look back period?
Patty, I don't disagree with you at all because, if you listen to the medical experts, at least a 2-week incubation period. So if we go back to the 15th, that means if I go back to work at a construction team on the 15th of May, and I'm infected that day, maybe on the 29th, it may show up. And you're right, the longer you wait, really the safer you are. But I think that comes back to the governor's decision-making process. He has said at least, and I always say key words are at least 2 weeks in between phases. And I think what the governor's trying to do is do it safely, but also recognizing the pain that people are in. So there's no easy answers. You are not incorrect in terms of lengthening that period. And I'm sure if you own a business and you can't wait to get your people back to work and really start generating revenue, you don't want to hear waiting any longer. And I do think some of the states that reopen sooner, time will tell, did it work or not? If you're not testing as much as we are, you're not going to see the same infection rates. So, we just got a shipment coming in of reagents. You need reagents for successful testing. The state has been great getting us resources. The hospital systems have been great working together on this. But I honestly say we probably won't know the impact of phase one, really the impact, until probably the first 2 weeks of June. And to really state it succinctly, but I don't think people want to hear that. And it's up to the governor to make the decision when we are going to open to phase two. But that also indicates why he's taking, a cautious step-by-step process to do this, not go overboard and be able to test and measure. So we'll know a little bit more. People have said it's going to happen Friday. I'm telling you, no one's told me it's going to happen Friday. I think Friday is the second week. I do think we'll hear something, an announcement in the next 2 days from the governor stating when this will happen, be it this week or beyond, but we should hear fairly soon. But I don't want to put words in his mouth. He's going to make his announcement when he is ready. And then the guidelines go up very quickly on the state website. So, we'll hear soon. But again, we might not know the impact of phase one until mid-June.
Got about 9 minutes left and a few more follow-ups. Berkeley Breen has the next follow-up.
Thank you, Dan. Bob mentioned that you give the best advice you can give, that you get the information to the governor. It's ultimately up to the governor to make the decisions. But when you give the governor this information, are you advocating for our region to reopen on phase two?
Oh, Berkeley, here's the thing. Certainly, the governor's advocating for everything to be open.
Are you advocating for the region? Are you advocating for the region?
That is a question that doesn't need to be answered. I advocate for this region every single day. I end up getting information to him. We take in plans. We advise people how to prepare. We get them ready. We forward plans. We forward suggestions. We forward ideas to him. Berkeley, of all the regions, what got announced first to reopen? The Finger Lakes region. We're the first ones to be announced to reopen. And I think our control room, the team we have here in this 9-county region, is doing a phenomenal job. We are all advocating for a region. We're advocating to reopen safely and reopen methodically. And so that's really where we're at right now. Do you think any of us would want a business to be closed one extra day? No one does. Not the governor, not local officials, not business owners, not residents. I think we all want this to reopen, but reopen safely. So that is a consistent message we get. And again, it's not a job that anybody would want. The governor, he'll get all the blame for things that people feel should happen sooner, but we give him and provide consistently, and his team, I think, some great, thoughtful, comprehensive reopening plans that people put together that I think are amazing. And I think do protect customers, do protect employees going forward. And his team has those. As you see guidelines come out, a lot of those guidelines that we're seeing so far come out are reflective of a lot of those plans that we have sent forward.
Got about 6 minutes left. Rebecca has a follow-up.
Berkeley, if I can go back one thing, the Berkeley's question. Berkeley, here's one thing about advocacy. Advocacy is not getting up at a press conference or stating what I think should happen. Advocacy is working behind the scenes to try and provide data and logic to people to make decisions. Help them make a decision, answer those questions. And I think sometimes I love the people that get on social media and otherwise, make comments, get out, and listen, you can jump out front any day and say this should happen. It doesn't help the cause. And I just hope that some of the comments that get made don't slow us down. We want this not to be slowed down. Our economy needs to get back on track, but we don't want to get back on track for 2 weeks and then get shut down again. So I don't think anybody has advocated more in this region for businesses than this organization has over the last 2+ months, every single day.
We're going to get in Brian Sharp from the DNC for a first-time question.
Yeah, I just wanted to, there's been questions about restaurants and whatnot. Can you talk a little bit about what you see as the preparedness to do so if and when the governor announces those? What have you seen in the number of folks who've been able to submit plans at this point, as well as local governments being prepared to do whatever is necessary for either curbsides, in the streets, parking lots?
Brian, I've been on phone conferences with the governor's team and with restaurant owners from this area going through plans. There's been some phenomenal plans that have been structured. Plans that are socially distanced, the tables, the disinfecting, the masks, the hand washing, the whole bit, even social distancing and protection in the back end where the chefs are in the kitchen. Very thoughtful plans. I think the issue comes down to, restaurants where people gather. And I listened to a restaurant owner from New York City talk on TV yesterday. He has trepidation about opening too soon. So we have been on these conversations with the governor's team. We have forwarded plans from associations, from individual restaurant owners, some that own several restaurants. I have not seen a bad plan yet. They're thoughtful, they're comprehensive. So my sense is whenever the governor gives the okay, phase 2, phase 3, these places are ready to go. Right now, most of them are ready to go with takeout and pickup. I routinely go to restaurants now and get takeout. Their operations are flawless, how they're set up right now. You call ahead, give a credit card, you pull up, they come to your car, they drop it off you go. So I do think once the okay comes, they'll be ready to go very, very quickly. 2 challenges here. Hiring back their staff, getting people back to work is a challenge right now for many businesses, number one. And number 2, getting the confidence of the consumers and customers back. Some will come right back on day one. Some may not come back. I think we have to build that up. And I'm just saying that this fear and anxiety people have about going too quickly or opening up too soon is there. And we have to, and I think you build that confidence by having a plan in place. And those that scoff at distancing and masking, I'll tell you what, you can scoff all you want. You probably don't own a business, because if you did, you would follow certain practices, and you want people to come in and feel confident to come in. That's what we're reinforcing with our business owners now. So when the governor says go, I would sense they're ready to go. And going back to phase 1, I would say there was not a whole lot of delay once they got the word they're open, or they got things back up and going.